Hi everybody, welcome to Candid Chats, all things wellness. Today we are sitting down with the wonderful Miss Lindsey Guillory. She's joining us today to talk about mental health awareness and addiction counseling. How you doing today, Lindsey?
Doing great, Candid.
Why don't you go ahead and introduce yourself and let everybody know what your title is and your educational background.
Hi everyone. So I'm Lindsey Guillory. I have a master's in education in clinical mental health. That was after my fashion design degree. Knew I wanted to do something greater. Tried to be a teacher, and once I started working with kids, I said, I really want to work on a deeper level with people. So got my master's in clinical mental health. And focused in addiction, and so I'm a licensed professional counselor and licensed addiction counselor, and I have a private practice here.
Awesome. So you are in private practice. What are the different types of counseling that you do?
So I do individual counseling, family counseling, groups. We host different specialized groups. We'll be starting an outpatient group for co-occurring disorders soon. So that's kind of what we're doing right now.
What's a co-occurring disorder?
Co-occurring is a combination of mental health and addiction.
Okay.
So it's kind of, you may struggle with just mental health, or you may struggle with addiction, but it's when we look at both together.
Trying to get to the root cause.
Trying to get to the root cause, trying to, it's when you have the combination of both. So you may have someone who struggles with bipolar disorder that's using opiates to self-medicate the bipolar symptoms.
Okay.
So we're treating both disorders simultaneously.
Okay. So if someone is watching today and they're wondering, maybe I do need counseling, like what is the purpose of counseling? What would you describe that as?
My best description for counseling is helping you to help yourself. It's not about how I feel, how, what my opinions are on life, what my political view is. It's about me helping you to kind of dig inside yourself and take how you feel about things, take your belief system, take your values and your ethics, and helping you to develop your own ideas and your own feelings about life and your own solutions to problems.
Awesome. So basically you're giving me some extra tools that I
Yes.
might need from my toolbox, and maybe even just it's just a great idea to have someone unbiased to listen.
Yes. Non-judgmental, everyone who walks in here, I always say, look, I'm not judging you. There's no judgment here.
Right.
These are your four walls. I'm your genie in a bottle.
Yeah.
Like, you just come in here and we're going to talk about what's going on with you. And, I'm here to help you. I am your advocate.
Help you make a game plan.
Yes.
Yes, that's awesome. What services do you offer here? And you said group counseling.
Individual counseling. I work with adolescents all the way up to older adults. We work with either mental health, addiction, or the combination of both.
What is something in adolescence that you see coming in lately?
So, in adolescence, the teenage brain is not developed
Right.
until the age of 26. Most people don't realize that. So teenagers are focused, that they're emotionally focused. So whenever you are asking your teenager, did you think before you did that? No, they didn't.
You didn't.
They did not think before anything. They felt and they did. So kind of, what I do is I'll work with that teenager to kind of have that stop and think moment
Right.
before the do.
Yeah.
So it's I feel, now let's stop and think, and before we do.
Consequences.
The consequences, yes. Playing the tape through.
Right.
So and then teenagers are going through a lot. They've got their hormones are raging, their feelings are raging, you know, all the different things that are happening. They're trying to find their identities. They're trying to find their place in this world. And I just have such a passion for teenagers, you know, working with them. And so I'm just trying to help them find their place and help them to develop their identities.
And to think they're not developed till 26.
I know, scary.
Yeah, and a lot of us are already married and have
scary
kids
thoughts.
By that point, and we're consuming alcohol.
Absolutely.
Making a lot of bad choices.
And that's the other thing, you know, in talking to a lot of kids, you know, a lot of kids are using these days. A lot of kids, a lot of my work has been done in inpatient facilities, working with teens and substance abuse. And a lot of kids are not educated on what they're putting in their bodies.
Right.
So when you tell them,
and as a parent can
absolutely
tell them, but they'll never really understand. Sometimes it takes another voice.
I tell my teenager something, he rolls his eyes at me. He could
even though mom's a counselor.
Right. He's just like, you're a counselor, get out my face. I never want to talk to a counselor. But, you know, when I talk to other people's teens, you know, and I say, hey, you know that, you know, 60% weed you're smoking and you trust your drug dealer because he tells you it's pure, guess what? It's tearing up your stomach. That's why you have IBS. No way, Miss Lindsey. That's what causes IBS.
Oh,
you know, they have no idea the impact that the THC has on their gastrointestinal system.
It's not just the momentary high; it's the long-term effects.
Long-term effects. You know, the potency of drugs. You know,
and even adults have no idea.
Adults have no idea.
Teenager, you can't even process that.
Right. So, just working with kids to educate them, you know, I believe that education is key. Self-awareness is key. You know, the more self-aware you are, the less inclined you are to destroy your body.
And even as adults coming in, are you helping them with, like, I mean, obviously addiction, but what about everyday life stuff, like, you know, goal planning and things like that?
Yes, we work on how to do life. I treat a lot of adults with generalized anxiety disorder, depression, bipolar disorder. It's a huge one. Right now is the changing of the seasons.
Yes.
Family time. Thanksgiving.
That's a big one for a lot of people. Seasonal changing, even if it's just gloomy outside, everybody feels depressed or really tired and sluggish. And a lot of people just kind of shut down until springtime again.
Absolutely.
You know? And then, of course, holidays, you know, for a lot of people, that looks like I have to interact with family who I don't talk to all year long, and now, you know,
what do I do?
What do we do?
How do I sit next to Aunt Rose, who always pinched me and told me I was fat? You know, what do I do? You know, these people make me want to eat. These people make me want to drink. You know, what do I do? How do I function through this process? So yeah, I mean, just processing sometimes. How do I have boundaries with my family? You know. How do I do this? Or I haven't spoken to this person in 5 years. How do I even handle this?
I think that's a big one for families too. You know, like you feel like you have this sense of responsibility. She's my sister, so we have to have a good relationship. And then you eat yourself alive because you haven't talked in 4 or 5 years. You know, I think that would be great to have a counselor to help you to understand how to break the ice again, or how to get over that hump of whatever it was that tore the relationship apart.
And sometimes counseling is just about validation. Sometimes you just need your feelings validated, you know, to know that it's okay to feel this way, you know, because your truth is not my truth and my truth is not your truth, you know, but it's okay for each of us to own our own truths.
And it could just be not knowing how to approach that person and have a conversation with them that could completely heal your relationship. Absolutely. So you just stay standoffish and separated. So I think that's a huge value in counseling and therapy that you guys provide.
Absolutely.
Awesome. So we talked about what kind of clients you do see. Are you able to diagnose?
Yes, we are able to diagnose. We are different than a psychologist. A psychologist can assess. They can do the written test. And there are some LPCs, you know, that are licensed in assessments. You know, we can use screening tools to diagnose. And we can come up with the diagnosis in order to help you get to the appropriate doctor. If you need to go to a doctor for medication, if we see that the depression is beyond the point of being able to work through it primarily with just talk therapy, we can help you in that area with getting you a diagnosis. So we are able to do that.
So you guys do not prescribe.
We do not prescribe. We do not give medication.
And I think in a way that's kind of a great thing to start at that level, because you may not need to be on medication.
Absolutely.
And maybe you really just did need to have some talk therapy or to understand the root cause of whatever's going on that's causing the instability or the mental instability that's going on. Not everyone needs to just automatically have a pill for anxiety or automatically have a pill for depression.
Absolutely. I see a huge improvement in my clients, a huge release. In fact, I had a client yesterday who contacted me after her session, and she said, man, is it normal for me to just be tired after this session? And I said, absolutely.
Emotional release will do that too.
She said, I'm just going to take a nap. I said, you go for it, and within 4 or 5 sessions, you may notice that, wow, just releasing all of this junk has helped me.
She may not have even been sleeping properly because of all the stress and anxiety.
Right.
So just getting that off of her chest finally gave her the peace to be able to lay down and have a moment for healing for herself.
Absolutely. Yeah. So there is, there's answers, without the pill. Right. Sometimes, and sometimes you need medication, and we're definitely here if you need assistance in that process to get you where you need to be.
Right. You can direct them to the
We can direct them to the right people. We can work with those medical professionals to get you to the right place.
Now, if someone's watching right now and you have a family member who has addiction, or they need to start their road to recovery, and perhaps you don't even know where to start or how to help them, is that something that you're able to help with, Lindsey?
Yes. I've worked in the field of addiction for quite some time now, so I definitely have the ability to help you get through the whole process from start to finish. It starts with educating the family. Addiction is a team sport. Everyone plays a role. Everyone has a part. And it starts with educating the family. What is it? How do we deal with it? Where do we even start? How do you even approach the family member who's struggling? How do you react to their reaction?
Right.
What do you expect? What do you expect if they say, absolutely, I will not get help, go to hell? You need, it takes preparation.
Right.
So I have my toolbox of resources that I'm willing to help you get to the right places, to the right rehabs, to the right doctors, getting you to those necessary recovery spots that if you need help getting there.
Right. So even, Lindsey is really great at doing addiction counseling, but for, say if I had a child who had an addiction problem, I would not know the first thing about how to be there for them. Like, what's too much, what's not enough, what's enabling, what's just leaving them out in the cold, and I think having a good counselor who understands addiction is very important, because I would definitely need someone kind of holding my hand and guiding me as to how to help my child or my family member.
And there's a lot of shame and guilt associated with addiction, so it's something very delicate, very delicate that you have to navigate through. So
that's great. You can be there for the whole family.
Absolutely.
Now, you do have a codependency group that's going on for the next 6 weeks?
Yes.
And you probably will have some more in the future,
yes.
Assuming. Okay. So these are actually some groups that you guys can get in on by contacting Lindsey whenever she is putting these groups on. And we'll give you a little bit more information about how to do that at the end of the video. But for now, I just want to ask, what does codependency look like, say, in a relationship, and what is the ultimate goal of the group? Like, what do you want to see at the end of these group sessions with these ladies?
So codependency, if you Google it, you will find a million different definitions for it. It has a million different definitions, but
it does.
Yeah, ultimately the way I define it is you're losing your sense of self in someone else in an unhealthy way.
Okay.
Someone else or something else. If you think about how you can get addicted to drugs, codependency is in a way getting addicted to people, getting addicted to helping others in an unhealthy way, not having boundaries with those people. So with this group, it's an all women's group, and what we're hoping to do is have women walk away with a sense of empowerment, having an understanding of what their codependency looks like in particular, having them be able to walk away feeling like they took the first step in recovery, in working on themselves, in creating boundaries. And in this 6-week process, we are offering different therapists are going to come in, different wellness experts are going to come in. You're going to come in and talk about wellness and the benefits of self-care, because oftentimes, as moms, as wives, as sisters and aunts and caretakers, we sacrifice ourselves and we don't take care of ourselves. And wellness is a huge part of it. So it's important that we take care of ourselves, and so we want our women to be educated on this is how you can take an extra step for self-care. This is why it's important.
So can people have codependent behavior even if they're not in a relationship?
Yes, absolutely. Absolutely.
And that usually stems from childhood?
It stems from childhood. It stems on the way, it can stem from bad relationships with family members, with romantic partners, with addiction. Codependency, it's definitely has its roots in early development.
So you're basically just having them come in, giving them a sense of empowerment, reminding them to love themselves first, right?
Yes, and being able to form healthy boundaries, and that's the biggest part of this, is we want people to walk away being able to say no and be okay with it,
Yes.
Just be able to have a healthy boundary and be able to have their feelings validated.
That's priceless. Yeah. Is there anything else that you want to share about your practice, or any other kind of counseling that you do that you want to touch on? Because if not, we can just go ahead and invite them to contact you.
Well, I think what's important to note, a goal of mine when I opened my private practice was to have an environment where people could come and really spoil themselves, male or female, and part of that was bringing you on in here, and having a place where if a mom wanted to drop her teenager off and get a facial or get a massage and take care of herself while her teenager was having a session with me, that they have that availability. So it is bringing the wellness perspective into our therapeutic environment. Please come spoil yourselves. That is the point of this. Come and do talk therapy and then get a massage after if you want. Just take care of yourselves. It's important. We only have one life to live, so prolong it.
Yes. Yep. So for those of y'all who don't know, I do also share space with Lindsey. I'm in Dr. Swallow's office, and I share space here because she approached me and she said, I just really want to give people an option for self-care. So after they have a session, if they just want to wind down and relax and process everything that they just went through or talked about, just to give them a safe space to just walk over to the next room and get a massage or a facial. And like she said, also sometimes there's parents waiting in the front, and that could be very disgruntling and unsettling, and they're probably kind of nervous about what's going on with their kid or their spouse that's in a counseling session. So you guys can schedule a massage or facial with me while there's a counseling session going on with Lindsey. So
or some Reiki.
We have a whole little wellness center going on here, and I'm very proud to be part of that with you, Lindsey.
And it allows us therapists to just walk across the hallway and
yes, she
ourselves.
is my number one customer.
So
if any of you guys are interested in joining any of the future group therapies that Lindsey's going to be offering, or any addiction or mental health counseling that you may be interested in, I'll go ahead and let Lindsey let you know how you can contact her.
Yeah, so you guys can message me on Facebook, or you can call my business line at 337-450-9966, and you can text that line as well.
Yeah, and we're here off of West Pinhook in Lafayette, Louisiana.
Across from Folks.
Thank you so much for joining us today,
All right.
Lindsey. I'm glad I got to share you with the world, and thank you so much for all your insight.
Anytime.
All right. All right, y'all contact Lindsey if y'all need anything. Have a great day, and thank y'all for joining once again on Candid Chats.